Hi, I'm Steve Adler. You got a minute? Because I want to talk to you about what's going on in the city. Another day, I know everybody's continuing to get really anxious and frustrated. We both have the economic issues as well as the health issues. And then on top of that, yesterday, the president tells us that we could be looking at 250,000 people across the country that get this virus and die. You know, that's an accurate number. It's consistent with the numbers that we're seeing here from our experts. Now, we don't know that's going to be the number. It could be more, could be less. It all depends on how successful we are in doing the physical separations that we need to do. But we do know two things: that this is going to get worse, and it's not going to be over in 2 weeks. The governor and the president's orders to stay at home go through the end of April. Ours only go till April 13th, but it'll be extended both by me and by the county judge because we still don't know what kind of peak or hill we're going to be facing, which is why we all have to work as hard as we can to try and maintain the physical separation as much as we possibly can. I know it's frustrating and I know that it's hard. We are all feeling it, but somewhere we've got to find that inner strength and that commitment to see this through. Certainly at these initial stages when what we do is so important for deciding what it is that happens to us over the coming weeks. So how are we doing right now? This is a page from the city's website, austintexas.gov/ COVID-19. It's a great website. It has a lot of questions, frequently asked questions. It has this dashboard. We're at 305 people. 3 people have perished. Another one died here. This number, 305, is a number that's gone up a lot over the last 2 days. We're doing a good job of physically separating. We have to do a better job, especially in parks, on the running trail. We have to do a better job. But certainly we're doing a lot better than we did before. But this virus is so infectious. That's what's happening to us right now. So here from that same website, you can see how we were doing, and then it started to flatten off. And then here the numbers have now gone up. We have had an increase of 100 in the last 48 hours. Sorry about the black pen there. My printer at home didn't copy the whole thing. But the reason that the number has gone up over the last couple of days as much as it has tells us something about the infection. We had a group of folks that went out for spring break, came back, and apparently have brought the virus back with them. So a lot of them now are testing as confirmed. And not only that, but some of the people that they're running into are now coming back and testing confirmed. Even when you don't feel it, because some of these people testing positive are asymptomatic, they don't have any sign of having the virus, which means that they can unknowingly spread it to other people. That's what's happening. We have this kind of hot spot in that group, and we're going to do everything we can to isolate that and to treat it. But it's something that we all have to take to heart, because any one of us could be passing this on without knowing it. Which is why we really do have to do that physical separation. Especially need the attention of those in our community that are a little bit younger. Another page from that website, you can see ages across the top and how many of our confirmed cases are there. 84 people in the 20 to 29 age group, 71 in the 30 to 39 age group. We really do need young people especially to recognize that you can carry this and pass it on. And it's the passing on when it gets to folks that are susceptible that will be the real reason why many people die in our community if we're not able to get a handle on that. So we need to redouble our efforts. We need to really take care of those folks that are most susceptible. If you really want to do something to help the first responders and the healthcare workers, stay at home. Because what they want more than anything else is for there not to be a peak that's going to overtax them, but just a hill that they're able to manage. I want to talk about the susceptible populations because people are asking about it. Folks in nursing homes. We only have 2 nursing homes where patients have shown up confirmed. We've been able to take them out of those facilities. We've been able to stand up with a capacity of 100 beds operational, a parallel facility for folks that are in those kinds of nursing homes that don't require hospitalization but need that kind of a facility. We're able to take them out, the people they're around, we can remove them to that same facility. And I just want you to know that it's there. We're paying really close attention to that population. The population that's experiencing homelessness, also a vulnerable population. The city has now put to use a 300-room hotel. It's a place where we're able to quarantine or isolate first responders or healthcare workers that don't want to be around patients, or people that we need to isolate or let them run through the course of the illness so we can get them back online. It's also an opportunity to put travelers, if they come into town, they don't have a place to quarantine. We have the ability and are now put some of the members of our community experiencing homelessness in there. The one person who tested positively, and the people that person was around. But know that we have also now put under lease an entire hotel, a motel facility that'll be dedicated just to people that are experiencing homelessness. We have a couple more that we continue to negotiate on to make sure that we have all the space that we need, even with a surge, to take care of this really vulnerable population. We have an emergency food program that we're piloting that's looking promising, so that'll be available for folks in that community. We have a mobile hygiene clinic at 6 locations around the city that have been stood up by the Other Ones Foundation. The Parks Department's opened up 5 controlled shower areas for folks. 2 libraries have opened up bathroom access. 2 public toilets downtown available 24/7. The manager has initiated a homelessness strike team that is devoted solely to this. I want you to know we're taking care of the folks that live in our city. And now I get to conclude with one of the best parts of this. One, the reminder, please physically separate, wash your hands, stay home. Stay home unless you're doing something that's critical. But I want to share with you some artwork from Rosie. She's doing some art at home right now, outside her home. Absolutely beautiful chalk drawing. This piece she did inside her home looks like something that Picasso could have done. And Rosie in the 3rd grade is also experimenting with fabric scraps and has made her own mask. In a future episode of this, we'll talk about masks and the like. But for right now, this is as good as Austin gets. Hang in there. We're going to do this together, and be safe and take care of yourself.